The future of healthcare for immigrant communities. For as long as I can remember, my big sister has had a strong liking for medical documentaries and shows, which naturally became a bonding time for us as I joined her, sweeping us both into the busy lives of doctors and the emotional roller coaster that patients and their families go through in times of illness. Therefore, as her little sister, I am accustomed to engaging in conversation with the aspiring doctor, and I have come to grasp some concepts about careers and policies in medicine. Although I admire the noble work that medical professionals do, I am more inclined to having a career in business. To me, the growing business industry is critical in supporting all other industries and establishments, and it is an area of study that naturally interests me. During the pandemic, I have been keen to follow that most documentaries show that the Black community in the United States has been more affected by the coronavirus than other communities due to the absence of health equity resulting from strained economic and social conditions. In addition, immigrants, some of whom work in healthcare establishments, have taken the hit due to language barriers or fear of deportation for those who lack proper documentation. This phenomenon is not new. Minorities are often on the worst receiving end of the healthcare system, especially in situations involving infectious diseases. As a member of the Black immigrant community, I believe that even though this problem can be improved by the diversification of healthcare professionals by including individuals to cater for similar members of the community, outside organizations need to support the achievement of health equity. In order to improve the living conditions contributing to the factors that promote health inequality for the Black immigrant community, community-based and community-driven efforts are needed to alter environmental, socioeconomic, and cultural conditions in ways that promote overall community health. After I successfully complete my high school education and graduate college with a business major and perhaps a global health minor, I would love to take up a graduate course studying the economic impacts of minorities in healthcare. With this knowledge and the support of my family members, community members, and other parastatals, I plan to give back to the community by starting a Black and majorly immigrant-led business that will be able to provide employment and support those unable to sufficiently support themselves and their families. In order to come up with a productive society, it is important to come up with an enduring solution whose benefits will trickle down to the children in order to uplift the community as a whole. By establishing a Black-owned business with majorly immigrant workers, the organization will improve the quality of life of the workers, which will lead to safer communities, better quality of housing, and an encouraging environment where the children will thrive academically. In this way, the employees will be better equipped to cater for the health of their families through fair insurance rates negotiated by the company. In addition, it will be a goal of my organization to educate the employees and the community about their rights in healthcare, as well as provide translation services to improve the language barrier that often discourages older immigrants from receiving medical care. As far as I know, the United States is far from achieving racial equality in healthcare, but as a person with a chance to educate myself and contribute to the improvement of members of my community, that is a goal I aspire to achieve.